And every moment matters when you need an expert for a health crisis like a stroke. As we mentioned, October 29th is World Stroke Day, and joining me today to talk about strokes and some things you should know is Dr. Cynthia Dickerson, a neurologist and stroke specialist from HCA Health One Swedish. Welcome. Thank you for joining us today.
I'm glad to be here.
This is an important topic, certainly, and we were watching the story right before talking about how big of a deal that is. So, gosh, before we get started on details, just what does a stroke look like? What are the things people should be watching for as either the individual or like a caretaker, spouse, loved one?
Absolutely. The best acronym that I like to use is BEFAST, B-E-F-A-S-T.
Okay.
B is for balance. That's not walking straight, severe dizziness. E is for eyes. That's vision loss, which often people go to their ophthalmologist and don't think about stroke symptoms.
Okay.
F is the classic facial droop, but it can also be numbness on one side of the face. A is for arms, numbness or weakness in the arms. That also counts for the legs, numbness or weakness. S is speech changes, and T is time. Do not wait, go straight to the ER.
For one symptom, multiple of these symptoms, any of those?
Any of those symptoms.
Okay, and time is important, why?
Time is extremely important. The quicker we can identify stroke, the more that we can treat it, and the better the outcome for patients.
Okay, this story is talking about the prevalence of this. Who among us doesn't know someone in our life that suffered a stroke? What are you guys seeing these days? How common are we talking about of a situation?
So stroke is the most preventable disease, and it also can be extremely disabling. And so not only is it a disease of the elderly, which we tend to think about, it is increasingly since about 2021 in a disease of the young. And so
Really?
This is everybody.
What's up with that?
Yes, there's a lot of theories behind it, but young individuals as well are coming in with stroke. So this is important for everyone to identify, whether it's you or a loved one. We cannot do our job as stroke neurologists in the hospital unless people are identifying the symptoms and getting to the hospital quickly.
We talk about what you can do if you get in quickly, preventable and treatable, not just treatable. I mean, I know you don't have a magic fountain of youth and can turn back time, but what can we be doing in our day-to-day lives, or maybe understand about our own health history, which is probably the most important, to help ourselves here?
Actually, up to 80% of stroke is preventable. A lot of this is lifestyle modification, it's healthy diet, it's regular exercise, quitting smoking, but it's also identifying other medical conditions that when controlled can help prevent stroke as well. Diabetes, high blood pressure is the number one. Things like atrial fibrillation.
I know people with AFib that talk about this, yep.
Yes, regular health screenings and lifestyle modification can prevent up to 80% of stroke.
Okay, so people can help themselves here.
Absolutely.
And then if you are seeing these symptoms, what was it, BEFAST?
BEFAST, B-E-F-A-S-T.
I love that, okay.
Yes.
All right. Well, thank you, Dr. Dickerson, for coming in today, and hopefully we can maybe we can save a couple of lives and quality of lives, right?
Yes, I really want to encourage people. This is something for everybody, whether it's you identifying symptoms for yourself, identifying symptoms for loved ones, getting them to the hospital fast. There are amazing treatments these days that really can help prevent long-term disability, and we want to be able to empower and encourage others to be a part of that story.
Okay, listen to the good doctors, guys. They know what they're talking about. Thank you.